Hello. I want to welcome you to an abridged version of one of our town meetings, in that I want to talk about a review of all the protocols that we have in place as of today. And the key thing to know is that I'm not going to be introducing anything new or anything you haven't heard already, but I wanted to make sure that people are aware of how we're reopening and what's going on. And just one bit of housekeeping is that I'm going to be addressing this to the residents, but I also recognize that many family members are also going to see this. So if I'm referring to you, I'm going to be referring to residents. I just want to make that clear for everybody. Before I get into the protocols themselves, I just want to kind of do a quick review of how we got here. As you know, at the very beginning of March, when we all started to recognize that we would have a very unusual circumstance coming to the United States in terms of a pandemic. And we also recognized in early March that the people most affected by it would be seniors. And obviously, in our name, Hebrew Senior Life, we're all about making sure that we provide the safest possible environment for seniors. So as we were thinking, what do we need to do, it became very apparent to us very, very quickly that we had to shut down the campus. And shutting down the campus meant, nobody could come and visit, and that we would not allow the residents to do off-campus activities, and that we wouldn't allow any gatherings, include any staff gatherings as well as any resident gatherings. And the final act of making sure that we were really truly shut down was we literally shut off every single amenity. We basically closed up the community center so that nothing was available. Nosh, pool, Centro, all those things. And then as soon as we did that, we also recognized almost at the same time that there were many, many services that residents still needed to get. And so much of our energy and effort was spent on how do we get groceries to residents? How do we screen staff as well as aides that were necessary to be on the campus? We got rid of everybody that we didn't feel was necessary so that we could keep the population as low as possible. And one of the things we did was we created a resident response team so that we could call every single resident regularly and find out what do they need and how do they need it and what do we need to do. And that team worked very closely with the operators to figure out how are we going to make sure that no resident is left behind. And the good news was we did well. I mean, we were very, very fortunate. We had one case of a resident getting COVID, and fortunately, that person recovered. And the fact that we only had one, we do attribute to the strident rules that we put in place very, very quickly and operating very cleanly on that. So the next step was, okay, now that we've got COVID under control, and the campus as of today is COVID free. There's nobody on campus that has COVID, which is just superb news. With the state opening up and us knowing that we needed to get back to normalcy, we asked ourselves, what's the lowest hanging fruit? And how do we do this in a way that the resident chooses what level of risk they wish to have? So the first thing we did was we came up with 4 universal rules. They're very simple. You're going to hear them 3 times while I'm speaking to you because they're that important. And let me just go through them. If you're sick, and I'm referring to everybody, staff, aides, residents, children, visitors, if you're sick, stay home. If you're not and you come to the campus, you wear a mask at all times. And we tell the residents, wear a mask whenever you're outside your apartment. The third rule is keep distant from each other, meaning everybody should have a minimum of 6 feet of distance between them and any other person. And the last rule is to wash your hands and do it thoroughly so that you know that any surface you're touching, if you wash your hands after you've touched it, you've probably eliminated any risk from touching that surface. We added a fifth guideline that I think is pretty important and pretty universal, certainly with the set of protocols we have right now, and that is, if you can do something outside, do it outside. Don't do things inside. We know that it's safer to be outside with 6 feet of distance and wearing masks than it is to be inside. So let me go through the protocols that we have currently on the campus today. But before I start talking about each one of the things I want to make sure people really do understand is we want to make sure that unless something is specified in the protocol, you should probably consider it prohibited. And the reason that we have to do it that way is because if I made a list of all the things you shouldn't do, you'd probably get the sense of how unwieldy that would get and how long it would get and how confusing it would get if I just told you all the things you shouldn't do. So what I'm trying to do is say, here's the things that you can do and here's how you can do them safely. So if you follow the 5 rules that I've given you, and you do things safely based on the protocols, Newbridge will remain very safe. And that is everyone's goal here. So the first protocol that we came up with was bringing service back into the residents' apartments when requested, i.e., do you want housekeeping? If you do, you let us know, we'll let a housekeeper come in. If you need something fixed, again, let us know. We'll have an engineer come to your apartment. And there's a couple things that we ask that you as residents do to keep yourself safe. When somebody's coming to visit you, you wear a mask. And if you can, be in a different room than they are so that you're not even close to them as they're doing whatever their work is. The second thing is if you do need to explain something or you need to talk to them, keep 6 feet away, explain what you need to explain, and then go into the other room. And if you do those 2 things, you're going to stay safe and the staff members are going to stay safe. The second protocol that we looked at was the family visits. This is the second time I'm now going to go through those rules because the rules apply to all the family members that are coming to visit. And just as a reminder, part of the protocol is saying we never have more than 2 family members outside of a car talking to a resident, being together at any given time, only 2. The 4 universal requirements for family members, same as the residents. If you're feeling sick, don't come onto the campus. If you're here, wear a mask at all times, which means you can't have food. Be 6 feet apart from each other as well as the residents. Make sure you remain 6 feet apart from everybody that else is on campus. And that when you come, you've washed your hands, and when you return, you wash your hands. Those are the 4 rules. Please make sure you're following them for the safety of everybody here on the campus. And speaking of that safety, remember when I said staying outside is better than inside? At this point, we're not letting any visitors go inside. So you can't go into a resident's apartment. You are not allowed to come into our hallways and whatnot. So please honor that and respect that and plan accordingly. The only other thing I want to make sure that you understand is it's very tempting to hand something off, to deliver a package, hand off a gift and all that. We're asking that you not do that. If you need to leave something for the resident, please leave it at our front desk. We'll disinfect the outside and then we'll bring it to the resident later on. It's just another safety precaution and there's no reason not to do it. The last item I want to mention on the protocol of visitors is we look to the maturity of everybody coming to follow the rules that I've just outlined. And this applies to children as well. Now we're recommending that any child that comes on campus be 12 or older because we know that they have the maturity to follow the rules. It's in your judgment to decide whether your child has the maturity to make sure that they stay 6 feet apart, they keep their mask on, and do all the things the appropriate way. But you're responsible for your child to follow that. And if you don't feel that your child can do it, please don't bring them. The next policy that we introduced was using the car. Now, initially, the idea was so people could get the oil turned over, make sure the tires are okay, make sure the battery stays live. But we quickly expanded that so that people could travel to another location as long as they maintained the 4 rules. And one of the things that I want to make sure that everyone understands is that, you know, the car should be considered an extension of the apartment. So think of it this way. If you and your wife share an apartment, you share the car, that's okay. But you don't want to be putting guests in your car. You don't want to have family members joining you in your car, because that would be the same as them coming into your apartment. So, and it works in reverse. I'm asking residents not to get into family cars for the same reasons. You can't stay 6 feet apart. It's very hard to keep your mask on and be understood in a moving car and stuff like that. So just don't do it. A couple of good ideas that we added to the protocol, I just want to make sure everybody's aware of. Bring sanitizing lotion. If you do get out of your car, you do experience some outdoor activity, when you get to your car, sanitize your hands so that you keep your car pristine. And the second thing is, don't go into stores or don't go into pharmacies to pick up your items. Have them do curbside, put the items into the trunk so that you don't have an indoor interaction. That'll keep you healthy and make sure that we keep the campus healthy. One of the things, I kind of covered some of the things to avoid, but you know, it doesn't hurt to review them. You want to avoid in-store shopping. You want to avoid attending gatherings with over 10 people. Meeting up with friends or family off campus without social distancing and masks, that's an obvious one. Hospital visits except for outpatient medical appointments only. Vacations, returning from second homes. These are things that, and when I get to it, you know, what could cause a quarantine, these are the things that would happen. The next protocol was actually returning from a second home or going on vacation. And again, the whole key here is if you go, you probably have had contact with somebody. It doesn't matter whether you've left for a night or you've left for the summer. When you come back, we're asking you go into a 14-day quarantine so that you know that the rest of your neighbors are going to stay safe. We also introduced the companion idea, an exclusive agreement that you make with one other person. And the idea there is you basically form a combination where you're like married. Obviously, you're not sharing the same apartment, but you get to treat each other as if you were in the same apartment and married. And what that means is you can dine in either of your apartments, which means you can take off the mask, you can be within 6 feet. And the key thing there is to recognize that whatever the risk profile is of the person you're companioning with is similar to your own. You don't want somebody who's going to take great risks and you who may be conservative getting into disagreements as to what's okay and what's not okay. So have a long conversation. Make sure you all feel comfortable with what you're planning on doing. And that will prevent any mishaps. If one does have a reason to have to go into quarantine, the caveat is the other person must go into quarantine as well. So as long as you honor that caveat, it's absolutely okay to decide on having somebody as a companion. Just let us know so that we know that the two of you are companions. The next item was about outpatient visits to our medical practice or therapies and all that. And the key thing here is if you're sick or you're not feeling well, even if you have an appointment, call ahead of time. Do not leave your apartment if you're not feeling well. I know this is counterintuitive because you want to go see your doctor if you're not feeling well. Call first. You will talk through how to resolve the protocols so that you keep the rest of the community safe. And like I said, you have to have an appointment, no walk-ins. So if you're going to see medical practice here, you want to make sure you have an appointment. The next protocol that we introduced was about the salon, where we are now allowing people to have their hair done as well as their nails done. Excuse me. And I just want to make sure that people understand that the protocol here is we don't want you to be waiting in a waiting room. Wait for them to call to make sure that it's okay to come down. If you've decided to go to a salon outside of Newbridge, please refer to the Massachusetts guidelines for how all the steps they must take to make sure that they can open, and ensure that wherever you're going has fulfilled all of those things. Don't just take their word for it. Go through the checklist to make sure that you know that you're going to be safe when you go. As I've said to many people, this is the one area I am by far most worried about, because by its very nature, it does break one of the rules, and that's being within 6 feet of another. And there's no way to get around that. So since we're breaking the rule, be extra, extra careful on this one. I do really appreciate it. And the last thing that we introduced was mail pickup. Again, this is something you have to opt into. Otherwise, we're going to continue to deliver mail to the residents. And if you've decided that you're going to pick up your own mail, great, just let us know. And the only request I have on this protocol is if you meet up with a friend you haven't seen and you want to have a chat, don't hang out in the mailroom. Go outside, have the conversation, socialize outside 6 feet apart, that sort of thing. So let me just go through real quick what could cause a person to go into quarantine, because this is a commonly asked question that I get from people. The first and most obvious is, if you tested positive for COVID, you're going to be quarantined. Expect that, of course. We don't want you walking around and having your shedding of the disease possibly affect another. The second is, if you've been exposed to somebody who tests positive for COVID, you didn't know it at the time, but you've been exposed, we're going to ask you to quarantine in that situation. If you go to the ER, which obviously still has a very high incidence of people that may have had COVID, we're going to ask you to quarantine if you go to the emergency or go to the hospital for anything but a routine appointment with a medical doctor. Excuse me. The other thing that will cause a quarantine is if you've gone traveling or you've been away at a second home or whatever. When you come back, we'd ask you to take 2 weeks off, not expose whatever you might have been exposed to at the other location. And then the last thing is what I call a risky group. And basically it's any setting where your mask comes off, where you're within 6 feet of another, and things like a wedding, or you've gone to dinner with your family, or you've gone to your children's house and you visited with them and you weren't able to stay outside the entire time, 6 feet away from everybody, or you had some cake for a birthday party where the mask came off. We're asking you to be honest and come back and say, listen, had a great time, I'm going to take my 14 days and keep the rest of the community safe. That's the goal that I have. I'm not bothered by the fact that you may wish to take the risk. I would be bothered, though, if you wanted to share that risk with everybody else. And the last thing I want to do is I'm going to go over the rules for the third but final time. When you're sick, stay home. Wear a mask at all times you're in public. Stay at least 6 feet away from any other person that you're with. And wash your hands often, and when you do wash them thoroughly. And wherever possible, stay outside. Don't go inside and do the things that you want to do, because that's the safest place. Our goal here is that we know the fewer people we have on campus, the less exposures we have, the better. This is one of the reasons why we're trying to limit the amount of private aides that are coming on campus. It's just an added protocol, an added group of people that add some risk. Same thing with our staff. We still have many of our staff working from home wherever possible. The risk assessment, as I think I've made clear, is yours. You're responsible for your own health. It's not something that I should be deciding for you. You have to feel comfortable with what you're willing to do or not to. But I do feel confident that if you're following everything that I've outlined here, and that you do it well and you do it thoughtfully and you think of others, that you, as well as the rest of the campus, will remain safe. And if you want to learn about the protocols with more detail, they are listed on the resident website. So I wish you to go there anytime you have a question. And I guess I want to end with just one last thing, and that is, if you're in doubt, ask me, ask Tara, ask Victor, ask David, the people you know that work here. Ask us whether you feel that what you want to do is a reasonable enough risk. Otherwise, we're asking that you don't take that risk, or if you do take that risk, that you recognize that you've taken the risk and that you go into self-quarantine and you let us know, and you let everyone know that you want to keep their neighbors safe. We are not out of this by any means yet, and knowing that the amount of risk that someone takes and the amount of harm that could come by just one oops has us being very vigilant. My promise to you is, as we gain our confidence on things working, we'll look at other things that we might be able to do. And it might become a little bit more broad as we go on. But for now, these are the rules that we have set up for the campus, and we hope that you honor them. Let's stay healthy, let's stay COVID-free, and I really do thank you for listening.